the best part of my job is when I am one-on-one with somebody in the exam room, getting to know them, talking about their concerns and their questions, and then just helping them find solutions, helping them navigate a path that is going to help them feel better and live better optimally. If I'm talking to other practitioners, I would say, yeah, don't give up. Find something else, because HELPcare is wonderful, and fortunately there are other direct primary care clinics popping up also. But I would certainly advocate for something like this to anybody. And for patients, yeah, there are better solutions, definitely. There are ways that you can feel better, and sometimes it's just thinking outside the box and getting outside of the system.
Welcome to Take Charge with HELPcare. Glad to have as our guest today Elizabeth Hedlund, who is our first physician assistant who joined with us in February 2023. And so, Dan, I'd like to have you take it away and help us learn more about Elizabeth and what makes her tick and why she's a great part of what we're doing here with HELPcare Clinic.
Yeah, welcome to the podcast, Elizabeth.
Thank you.
Thank you for joining us today. So let's just start by you telling us a little bit about yourself, where you grew up, about your education, anything about your family you'd love to share, just so our audience can get to know you a bit.
Sure, yeah. So I grew up in a small town north of the Twin Cities called Scandia, Minnesota. A very Swedish small community there. And growing up, I worked hard. I was a good student. I did what my mother told me most of the time. And so when she suggested I look into medicine as a future career, I hadn't really thought of it before, but there were no medical providers in my family. But I thought, you know what? I love kids. I love working with people, and I work hard. So I think that's something I could do. And so, so I pursued medicine in pre-med in my undergrad, and then went to PA school. And then, but before I started PA school, met Ryan, who is now my husband. And so we ended up getting married in the short week between my classroom studies and my clinical studies. We got married and went on a honeymoon, and then off to clinical rotations. And then we now live in Owatonna. I worked in medicine now for 24 years. In that time, we've had 4 children, 2 biological children, and brought 2 into our family by adoption. So we have 2 in college and 2 at home, both hockey players, so that keeps us really busy, but we love it. And yeah, most of my career has been family medicine, but I've done a few little things here and there in between.
What have you loved most about your career and your involvement with HELPcare?
Yeah, I think the best part of my job is when I am one-on-one with somebody in the exam room, getting to know them, talking about their concerns and their questions, and then just helping them find solutions, helping them navigate a path that is going to help them feel better and live better optimally.
And so at what point did you feel like you might want to make a change to work with HELPcare?
I think it started a long time ago, and I just didn't know what choices I had. And when I started family medicine in late 2001, it was very different than it was when I left traditional family medicine in 2021. And it was kind of a slow change over time that just made practicing medicine the way I wanted to very difficult. And to the point where when I left in 2021, I was done with family med. I said, this isn't what I want to do anymore. It's not how I want to do this practice, this medical practice that was my intention when I started. And a lot of that just has to do with the system in and of itself, and not necessarily the people that I worked with, but the system is just really broken. And I think most people that are either patients or practitioners or work in healthcare would say something very similar. And then after I left in 2021, started working at urgent care, and then come to find out the existence of HELPcare, because I didn't even know about it for a long time. But when I was expressing frustrations with the medical system to two separate friends of mine at two separate times, they both said, well, hey, have you heard about this little clinic in Austin? And after my second friend said that to me, I thought, okay, you know what? I better check out this little clinic in Austin. So that's when I emailed Lee, and he was able to get back with me right away. And I came in and met with Lee and Dr. Dave, and then started, in February 2023.
I've told the story a lot about how I got this email from Elizabeth back in October or so of 2022, where she said, I'm kind of so frustrated with healthcare and the way the healthcare system is that I think I might need to just either come work with you guys or quit healthcare altogether. And so we were so delighted to get to know her. I mean, to get to meet her, but then to get to know her over this time. She's been a ray of sunshine, in at HELPcare Clinic. One other story that I have told a few times too is we had somebody from one of the neighboring communities who really wasn't a doctor kind of person, but she was sick and she needed to be seen, or she wanted to be seen, and she wasn't a member yet. And we said, well, we can't get you in to see Dr. Strobel, but we could have you see Elizabeth today. And what we can do is put an appointment on Dr. Strobel's calendar for 3 weeks from now. But then we can have you see Elizabeth today. And anyway, she came in, she saw Elizabeth, and on the way out, she said, cancel my appointment with Dr. Strobel. And so
don't tell Dr. Strobel.
No, right. Well, I've told him, and he's okay with that. He loves that. Actually, it's great having practitioners here who it's all win. Whoever you get to see is somebody that really shares the approach and has been drawn to this kind of practice.
Yeah, it's a great story. So help us understand really a little more clearly the difference between where you were working before and where you're working now.
It's hard to even know where to start, but I think one of the main things is just time, the time factor with patients, the time factor to do things outside of patient care, because in the constraints of the system, you're stuck with a short appointment. And one of the things I love about working with people is just the education piece of it, and really talking about, okay, you're having these symptoms, but where are these symptoms coming from? And then you figure that out, and then you really know how to help somebody. But when somebody comes in and you have 15 minutes to talk with them, the quickest thing you can do to maybe help them feel better is give them a prescription. And so then they're just taking more and more medicine, and then and not necessarily getting to the root of the problem or even really feeling better. So time is a huge, huge one. And that also just gives you a chance to get to know people. And that's ultimately important, because if you get to know them, you build a relationship, you build trust, and then everybody's more confident in moving forward together. So that's big. I also just love the fact that we don't have to deal with health insurance companies so much, a little bit here and there with prescriptions, but really, so often I would try to do something for a patient, whether it was getting them a blood sugar monitor or an inhaler for their asthma, or even an antibiotic, and then you get a message back from the pharmacy, well, this isn't covered because their insurance. And there have been a few times with inhalers in particular where I'll send 3 different prescriptions to the pharmacy, and finally I just have to tell the patient, will you call your insurance and find out what they will cover for you? So it's the insurance company that often decides what you can and can't do, versus the individual working with their practitioner. So that's a really big difference. I think also our relationships in the clinic is just invaluable to me. The friendships and the people that I work with, and that teamwork approach that I haven't always experienced with other places. So it's a world of difference.
Three great things: more time, fewer insurance hassles, and a great team to work with.
Mm-hmm.
Yes. Can you think of a patient experience that kind of illustrates this benefit of having more time and more personal attention?
Sure. And not even one specific, but over the last few weeks, I've had a handful of people, because we're seeing a lot of new people right now. I've had a handful of people come back with messages saying things like, it's been so long since I've felt heard at an appointment, or since I really had somebody listen to me, or I've had hope. I mean, that's a huge one. People need to have hope, and they need to know that somebody cares about them, and that they want to work with them rather than just give them 2 cents and out the door they go. So just those little comments from people telling me, thank you for giving me that hope. Thank you for listening to me. Thank you for caring about me in the way that we do.
That's great. Well, and to give us a little context, when you say you have time with the patients, is that 20 minutes instead of 15, or is it 30?
Sure,
Or what's kind of a typical patient experience when they come in?
sure, absolutely. Well, in the traditional system, our appointments would be either 15 minutes or 30 minutes long at the most. And that was it could be anything from a cold to abdominal pain to I need a full physical with all the screenings recommended. Um, Whereas at HELPcare, our appointments might be 30 minutes, but more often 45 minutes, and even so an hour for our new patients and patients that need a little bit more time. And that is practically unheard of in any other place that I've worked.
How are you able to take that much time? I mean, what about the model allows that much time for patients? And maybe Lee could share a thought here on that.
Yeah, maybe
Or
Lee
you
wants to
could,
share
whichever one,
that.
right?
Well, so part of it is that I think, as Dr. Strobel's talked about, doing a 1 hour appointment is way better than doing 4 15-minute appointments. Because you're actually having the time, and if you do the 1 hour appointment, you can make more headway, and you can help people take charge of their health, and you can help them make some lifestyle changes that are going to make a much bigger difference than getting the medications exactly right. If you can give them some lifestyle support and health. So part of it is that membership relationship that we have, is that we're not just taking anybody off the street. I mean, anybody can get a membership. It's open to anybody, but it's not, without that membership, we aren't seeing the patients, because we do want to have that relationship, because then we're investing in them, they're investing in this kind of approach to care, or their employer is, if they have an employer-based, program. But by having, but building those relationships, hopefully you help people get better in charge of their health. They get into a better health state. They maybe don't need to see as often. People don't complain if they didn't, if they had their car insurance, they didn't have an accident this year and they didn't need to use it. If our practitioners can help people get healthier so they don't need to see us as often, then it's really a win-win, because they're able to take care of more members, and that is financially profitable. But also it's just rewarding. I mean, it's all about the, being able to see a difference. It's like, if you can get aligned together and get all the incentives aligned, it works.
And I will often tell patients, if they have a list of symptoms and questions, say, you know what, if you can come in once a month for the next few months, we can really tackle these things within 45 minutes to an hour with each appointment. And down the road, then you're going to be in a much better place. And then we're not going to need to spend these monthly, hour long or whatever visits. But this is Like initially it's like cleanup, like let's figure out, let's get to the root of it. Let's clean up. Let's get rid of some medicines if we can. Let's clean up your lifestyle a little bit if we need to work on nutrition or sleep or stress management, whatever. And so, yeah, ultimately people are becoming healthier, living better, and don't need to come in as often.
So our practitioners are on average, I mean, our goal is that they're seeing 7 patients a day.
Mm-hmm.
You know, and there may be some cases where it gets a little busier and they need, and they squeeze somebody else in, you know, to make that work. But, you know, having that and having a maximum panel size of about 600 versus the 2,000, 3,000, 4,000 that they might have in the regular system just means you get to have those relationships that you can't, it's possible to have those relationships. You can't have a relationship with 4,000 people. It's just not, you know, our minds can't do that.
It is a big difference between traditional healthcare, you know, because you know, we don't have healthcare in where I live, and so
Yet.
I'm in that other system.
Yeah.
I'm thinking, you know, how unheard of it would be for somebody to say, "Oh yeah, come in every month for an hour. Let's get to the bottom of this." That'd be you'd be shocked if a provider said that to you in the traditional system, right? So,
Well, and in the traditional system, those appointments would be a lot more expensive because they're run through the insurance program, and the insurance companies would say, "Did you really need to see that person again? I mean, really?" But also they're more expensive, but they're also compensated less than those 4 15-minute appointments. And so that's kind of how the system all gravitates toward the shorter appointments, because it's just the way that you kind of maximize the revenue and also try to take care of 4,000 people.
and with healthcare, it's one flat fee a month for your primary care.
Mm-hmm.
And so you don't need to worry about, have I been in 2 or 3 times, or is there a fee for each visit?
Right. Yeah, I mean, our goal is we don't want this to be like a golf membership, you know, where you're making sure I'm seeing you so many times, okay, because that kind of can't work. But at the same time, we don't want people to be saying, well, am I really sick enough to get the care, you know? And so the problem with the regular health system is, say you have a $5,000 deductible, it practically means you never go to the doctor, you know, because it's all going to be out of pocket. And it's all going to be at that expensive sort of retail price that's artificially inflated by, you know, the presence of insurance. And so because of that, people, and they may even have a health savings account, but they still don't want to spend that money because it's like this, they're thinking of that as a retirement benefit or whatever too. So this way it's like saying for a reasonable amount that's not that much, you can actually get the care that you need when you need it.
I will sometimes tell patients too that there won't be any surprise bills that you get at home. And I've been a practitioner and a patient through the system, and I would get surprise bills at home. Like, what in the world? I had no idea this was coming. And even now, some of the systems, if you message in, because now so many people can get access to their chart online, so you message in, if there's enough of a question or concept that you're getting answers from your practitioner, then you also get charged for that. So the system is just forced to constantly find ways to build anything and everything if possible, which isn't fair.
Right. Well, the model that we're going for is that our practitioners have the incentive to treat you well and get you cared for as economically as possible. And if that means a video visit because it's more convenient for you, or we can handle it through just straight messaging, we don't have to worry about billing for it because we've met the need. You know, we've helped you with that need, and it's in the most cost-effective way, but it's all built into the what we're charging the membership.
So, Elizabeth, what advice would you give other practitioners who might be a little frustrated with the jobs they're in right now, and might be wondering about the benefits of a system like HELPcare?
Mm-hmm.
What advice would you give those folks?
Sure. I think primarily I would say don't give up hope. I think after you spend so much money on your education and so much time, dedication, trying to do what you felt called to do or wanted to do with your career, and to just throw that away because you're burnt out or frustrated, is hard. So just knowing that there are other options now, and it's a, like I said before, it's a world of difference. And um, when you can work in a new way, and actually see things getting better, um, it makes it worthwhile.
And so, do you have any other thoughts you want to share with our podcast audience today?
If I'm talking to other practitioners, I would say, yeah, don't give up. Find something else, because healthcare is wonderful. And fortunately, there are other direct primary care clinics popping up also. But I would certainly advocate for something like this to anybody. And for patients, yeah, there are better solutions, definitely. There are ways that you can feel better, and sometimes it's just thinking outside the box and getting outside of the system.
Well, Elizabeth, thanks for joining us today. And more importantly, thanks for joining us. Thanks for being part of HELPcare Clinic in Austin. You've been just, as I said, a ray of sunshine in our lives and in the lives of our patients and members here. And we're just so glad to be working with you.
Thank you. It's been my honor.
Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review, and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with HELPcare with your friends and on your social media channels. At HELPcare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the HELPcare Clinic difference at healthcare.health.